Hi, good afternoon, guys. Can you hear me? Today we are going to be speaking about step-by-step preparation. Today is day two of the 5-day free course. So today I'm going to talk about some really important points regarding how to prepare, what to do, what are the common issues which we face when we are preparing, and how to overcome those and what to do about those issues. Okay, so firstly, I'll begin with preparation. Okay, so basically, how I would like to categorize preparation is into four parts. I would say that preparation for this exam has four parts, starting with reading, listening, writing, and speaking. So these are the four important parts of your preparation. Okay, now why I have broken them down into these four parts is because when you start your preparation, this is how you start it. The first thing that you do is you read. What do you read? You read the notes that you have, you read the scenarios, the description that you get with the scenarios, and the content of the notes which you have, what it mentions, how people and what other information they have to give us. So basically, you start by reading. So you read. You read. I won't say that read all of 300 plus pages together, but at least start by reading one scenario. So let's take for example that we take one scenario and we categorize that one scenario into four parts. So we break it down into reading, listening, writing, and speaking. Okay. So you read about the scenario. So that's ticked. So you tick off the part which says reading. Okay. Now next we move on to listening. Now, what happens is in the listening component, basically we start the course where we have chosen, the academy that we have chosen to start the course at. We start the course over there and we listen. We listen to the lectures which are being taught to us over there. We listen about the idea of the scenario. We listen about some extra points and features which the tutors may have, which they may give you out of their own experience or out of so what do you do about writing? So basically you write the management. You write the management that you have read from your resources and you have listened from your lecture notes, and you also write a note about how you would change the management, as in you bring about positive changes. Okay, if you have information that this management is outdated, then you correct that management. Okay, so this is what I mean by saying writing. Now when you write and you read about it, you tend to remember it better. So I do recommend writing also. Okay, next, speaking. The last part of your preparation is speaking. So what are the things you need to eliminate when you're speaking? Number one, you need to eliminate bogus statements. Number two, you need to eliminate nervousness. And number three, you need to eliminate feeling shy, which comes out in your voice tone. Okay, you have to eliminate these three things, and instead, you have to replace those by confidence, factual description, speaking the relevant information, and showing honesty. So, these are the four things that you need to bring about in your speaking skills before you attend the exam. So, these are the issues in basically, these are the four steps that I have for preparation of Lab 2. Number one, let me summarize reading, read your notes. Number two, listen. Listen to the tutors you have to whom you have signed up for, right? Listen to them. Third thing is to write. If there are any changes that you would like to bring about in your case presentation, you need to write that down. So writing. Speaking, like I said, eliminate the negative parts of your speaking skills and bring about positive changes. That is confidence, factual description, relevant information, and honesty. Okay, so these are the four things that are really, really important. Now, here I want to say two things about the speaking skills. Now, I do agree not everyone is a public speaker. Okay, I do agree on that. Everybody has a different way of approach of different things. Okay, but try to think about this. This idea is basically also portrayed on the GMC UK website. They say that when you come to the exam, think that you are coming to attend any other busy day at the clinic. So basically, they are already telling you that we do not expect candidates to be nervous. Okay, so this is something, if you feel that you have problem with that, if you have been out of practice for more than a month or so, and you feel that this is an area that you need to improve, then you do need to work on it. Sometimes what happens is, you may know everything, you may know the reading part, you may know the listening part, you may be up to date with your management, you may be up to date with everything that needs to be updated with. Okay, but because you are a little bit nervous, and this happens usually when someone takes a break. Okay, usually when someone takes a break, and when they are back, then they do tend to experience some sort of nervousness, some sort of anxiety. So if you have those issues, then you need to work on those issues. It's very important that you fix them before the exam. Why? Because the first few minutes when you walk inside a cubicle and you present yourself, it is really, really important to be confident. Okay. Now, if you personally ask me, I'm sure that all of us, we have required help from other doctors at some or the other point in our life, right? So when you enter the room, you expect to find a person who is confident and compassionate. I don't think we would like to go for a second consultation, or we would like to approach a doctor who is a little nervous or anxious. Okay. Now, when a medical student is nervous and anxious, it is completely different because they are medical students. Please remember, here for the purpose of PLAB 2, you are being tested at the level of foundation year level 2. That means you have already finished the first year of internship. So for those of you who are not consultants or specialists, right? So if you are at that level where you have finished the first year of your internship, then this exam is testing you exactly where you are right now. Okay. So obviously, after we finish the first year of our internship, there is some sort of confidence. There is a little bit of um, what do you say, honesty, there's factual description, there's relevant information speaking, because we have been following consultants, we have been going for rounds, we've been learning a lot of new things. So these things come naturally. Okay, so this is the level that you're being tested for. You are not being tested for being a consultant, please remember. Okay, the question says you are a foundation year level 2 in this department. It doesn't say that you are a senior house officer, or you are a registrar, or you are a consultant in this department. There are various exams which are aimed at those levels, and those questions definitely mention that we are testing you at this level. But this exam tests you at the level of foundation year level 2. So please remember to always act and behave like a foundation year level 2. A foundation year level 2 doctor has 4 things in their management, that is confidence, factual description, relevant information, and honesty. Okay. When I say confidence, what I mean is, even if you have a differential in your mind, you speak about that differential to your patient. You tell them that right now, from the information you gave me, and when I examined you, I have 2 conditions in my mind which may be going on for you. To rule out which of the 2 is applicable to you, I would like to do some further tests, or I would also like to get an opinion from my senior. Okay, this is confidence. Factual description. So you are going to describe which one of the 2 conditions do you have in mind. So for example, if you think this patient has ventricular tachycardia, then you have to tell them that we think your heart racing is due to an abnormal rhythm. If you think this patient has a heart block, then you have to say that in your own words. You may have this, or you may have a condition called as, due to the abnormal rhythm, your heart works abruptly and also slowly at times. So if you have these 2 conditions in your mind, you have to explain it to them that this is what I think is going on with you. So that's what I mean when I say factual description. Relevant information. When I say relevant information, what I mean is, when you proceed to the next step of explaining your management, you have to convey to your patient that what are we going to do for you. So depending on which department you're located at, if you are located in the GP clinic, you ought to tell them that right now we will do an ECG, or a heart tracing in other words, for you. When we get the results of the heart tracing, if everything looks fine but we do not find any other cause for your symptoms, then we may need to refer you urgently to a specialist. So what are you doing over here? You are giving them relevant information that I'm going to do this test, but if I do not get any result, but you have symptoms and I don't know why your symptoms are still coming on, then because of the limited resources in the GP clinic, of course, you're not going to mention due to limited resources. It is understood, right? Because all these facilities for doing further investigations are not available in almost all GP clinics. So what are you going to do for this patient? I'm going to urgently refer you to the specialist who will decide what kind of a monitoring would you need for your symptoms and for your heart. Okay, so this is relevant information. Now, you need to ask your patient here, would you want to know what would happen in case you go to the specialist, and would you like to know, would you like to have an idea of what might happen over there? If they say yes, then you speak about the rest of the stuff that they are going to either consider putting event recorder, or they may put you on Holter monitoring. So any one of these two could be done. Let me explain to you a little bit more about what is an event recorder and what is a Holter monitoring. Okay, so you explain to them that way. So at each and every step, you go step by step. So you are demonstrating that I know what happens, and I also know that I must give this information to my patients in chunks, little chunks. So I'm dividing it them that way. So first I'm saying, you are here with us, we will do this test. If the results come out, we may need to refer you. When we refer you, would you like to know what would happen over there? Yes, doctor, I'd definitely like to know. Then you tell them there are these two tests which they may recommend for you. It will depend on which one is most suitable for you. So there is criteria to give the patient a event recorder. There is a criteria to give the patient Holter monitoring. Okay, those criteria, the cardiologist or the specialist, they know those criteria. Even we know about it. It's not that we should not know about it, but keep it very simple for the sake of the patient. Okay, just tell them that specialist will decide in accordance to your comfort which one of the two is more suitable for you, and they'll go ahead with that. Now, in when that will be reviewed, when the results for one of these two tests will be reviewed, we would exactly be able to tell you what is going on with you and what more do we suspect or how do we need to manage you. So basically, this is what I mean when I say confidence, factual description, relevant information. Now, for some reason, if you do not know about event recorder and Holter monitoring, then you can just tell them that for now I know this, that we are going to urgently refer you. That is, within 2 weeks, we are going to refer you to the specialist. Okay, and they would do some further tests. And if they ask you, what are those tests, doctor? Could you tell me something more about those tests? So you can tell them they are these tests. Unfortunately, right now, I do not know what more information about those tests. But what I can do for you is I can give you some leaflets, or I can call my senior and they would be able to discuss with you in a much better way about these tests and what is going to happen with you when you reach the specialist. Okay, so you can do this. This is a place where if you involve your senior, you're doing it for the right cause. That is, you're doing it because you are admitting that my knowledge in this area is limited. However, I do want to improve it, and that's why. But at the same time, I'm also looking out for you. I want you to get the information that you do need to know. So I'm working on these two issues and I'm going to do this. Okay, so this is basically what I mean when I say honesty. If you sit over there and even the patient is asking you, doctor, what tests are going to happen? What is the specialist going to do for me? And then you don't know exactly what is an event recorder, and if you don't know what is Holter monitoring, and you tell them some wrong information, if you explain some other test, right? If you explain something else, if you explain about measuring blood pressure for orthostatic hypotension, if you explain that test instead of explaining about what is an event recorder and what is a Holter monitoring, that candidate, unfortunately, I don't like saying this, but I will say this, is someone who will fail on the spot. Okay, so basically, know the outline of the management. Even if you don't know great detail and depth, it's all right. Okay, there is no need for you to feel embarrassed in saying that this is something I don't know, but I am ready to work on it. Okay, basically, you have to demonstrate that you are ready to work on it. It's humanly impossible to know more than 1000 conditions and more than 2000 tests. Okay, it is impossible. Everybody agrees with that. However, be honest. If you know something, you explain it. If you do not know something, get help and show that you're getting help for the right reasons. However, sitting over there and just because you feel quite embarrassed and you don't want to finish the station earlier and you give the patient wrong information, then that means you have demonstrated that, or the candidate rather has demonstrated that they do not comply with medical legal issues, they do not comply with ethics, and so many other things. It just becomes wrong in each and every way, okay, that they conveyed wrong information. So please avoid doing that. Honesty is the best policy. Please be honest. But when you are being honest, please make sure that you are doing the right thing. You are also demonstrating that you acknowledge the gaps in your knowledge and you are going to do something about it. Okay. So these two things are really, really important. And this is something that we expect as examiners. We expect this from FY2s. Now, why I'm calling myself an examiner over here is because I do take mock exams and I'm the examiner and I'm the patient at that time. And when I have a candidate who is enacting a scenario in front of me, I expect them to be honest and not tell me anything bogus. Okay, so it's very, very important. That's why I call myself an examiner. It's not because I'm really an examiner. Okay, I'm really sorry about that. Anyway, moving on, let's talk about two types of candidates. Okay, now basically in lab 2, there are two types of candidates. Okay, one, they have excellent communication skills. They have excellent interpersonal skills. They do not need to work on communication or interpersonal skills. The second type of candidates are those who are practical. Okay. Now, what I mean by saying practical is that they tend to, their interpersonal skills are very much oriented with clinical knowledge, with bookish knowledge. Okay. This is what I mean when I say practical kind of candidates. Okay. These candidates, they're not very comfortable using um, communication skills as the first category of the candidates, right? But it doesn't mean if you have a lot of clinical knowledge, if you have a lot of bookish knowledge, that doesn't mean that you are going to fail the exam. That it doesn't mean at all that way. What expected out of you is, if you feel your communication skills are weak, or if your communication skills are more clinical prognosis and book oriented, then use that knowledge to impress your patients and your examiners. Okay, use that knowledge. Like I said yesterday, that you open the book and you will see a lot of information in OHCM, and some of the information is actually very tempting. You would want to use that information in your exam. So you can take that knowledge and you can use it in your exam. Say it in simple words. Instead of saying palliative care, you can say end of life care. That's what I mean. Okay, so say it in simple, comprehensible words to the patients and to the examiner. And definitely it makes a difference in your score. Definitely it makes a difference in your confidence too. And when you present something which is relevant, which is honest, and which is from the book, I can guarantee you that it brings out a very good scores also in the exam. Okay, because this has personally happened with me, so I always advocate that. I always advocate that you use information, relevant information, and you do speak it out in the exam. It's just not possible that someone comes up with something on their own. They do read for it, they do speak about it, and then it just stays. So that's how it happens. And usually what we come across is we come across experiences from candidates who have already given the exam, right? And we know that, okay, this is the information I'm supposed to talk about. But if you open your book, it's already there. You don't even need to depend on someone for that information. This is what I'm trying to convey to you. So if you have read something in the book and you know that it's the right thing and you know you can talk about it, please do not hesitate in talking about it. Okay? Do not hesitate in doing that. So this is what I wanted to talk about, the two kinds of candidates. When you are practicing in a group, you may come across candidates who have very, very good, very excellent communication skills. You may have candidates with not so well and not so good communication skills. Please don't think that just because in comparison to the other candidate your skills are not that good, you are a failed candidate. It's not that way. Like I said, You can use your clinical and your bookish knowledge to impress your patients and your examiner, and you can still pass the exam. Some communication skills which you can incorporate would be in the management. For example, continuously speaking management, right? Continuously talking about it without asking them, do you understand what I'm trying to tell you? Avoid that, right? Just avoid that. So just give them little information. First tell them, this is what we think is going on with you. I've told you 3 things. Is there anything you would like me to repeat or explain in detail? If they say, no, no, I absolutely understand, doctor, then move on. So this is something that we expect from the candidates, right? So when you're practicing in a group, if you belong to the practical category of candidates, right, whose communication skills are not as good as the ones with excellent communication skills, please don't dishearten. Please don't think that you have signed up for failure. Just incorporate these little points in your management and you will still pass the exam. Why? Because communication is always two-way. Okay. Now, right now, what I'm demonstrating is one-way communication because I'm giving you a lot of information and I'm not checking if my audience is complying with me or not. This is one-way communication. When I stop and I say, guys, do you understand what I'm trying to tell you? And I get responses from you all in the form of verbal responses or even in the chat box, then that's a two-way communication. Okay. So always try to maintain two-way communication in your exam. So thank you everybody for attending the session today. I'll see you all tomorrow for day 3 where we talk about time management, interpersonal skills and more.